Hey guys, welcome back to my channel. So today I'm going to continue with the second chapter, that is drugs acting on gastrointestinal tract, which is present in unit 1. So I have given you already the first unit. In that we have covered 5 marks and 2 marks. So in the second chapter for first unit there is a long essay 10 marks. So today I'm going to continue with the 10 marks question and answers, and tomorrow maybe I'm going to give you the 2 marks question and answers from the chapter 2, and hope we will complete the first unit tomorrow for pharmacology 6th semester. So as per RGUHS question bank, and before I'm saying you that please do like, share and subscribe to my channel, as I'm doing a really hard work for you all people. So please, I need a subscription. So please do like, share and subscribe to my channel. I'll start from the chapter second, that is drugs acting on the gastrointestinal tracts. So long essay, that is 10 marks. I'll start from the first question. Classify anti-ulcer agents with example and write the mechanism of action and therapeutic uses of PPI, that is proton pump inhibitor. So the answer is peptic ulcer is thought to be a result from an imbalance between the acid and the pepsin secretion of a mucosal defense factor. So the chief cell secretes the pepsinogen, and while the partial cells secrete HCl in the intrinsic factor. So these factors that protects the mucosa are its ability to secrete mucus, bicarbonate and prostaglandins. So the mucus and the bicarbonate forms a layer which protects the gastric mucosa from the gastric mucosa and from the gastric acid. So a peptic ulcer is an open sore in the upper digestive tract. There are two types of ulcer. Number 1, gastric ulcer, and number 2, duodenal ulcer. So the gastric ulcer which mainly forms in the lining of the stomach, where the duodenal ulcer which mainly forms in the upper part of the small intestine. And the classification. So how can I explain you the classification, because I have the classification of anti-ulcers agents are in that number 1, drug that neutralizes the gastric acid, in that antacids are the substance, in that the examples are magnesium hydroxide, aluminium hydroxide, calcium carbonate and sodium bicarbonate are the examples for antacids, where number 2, drugs that reduces the gastric acid secretion, in that H2 receptor blocker, proton pump and muscarinic antagonist. So for H2 receptor blocker, in that cimetidine, ranitidine and roxetidine are the examples, where proton pump inhibitor omeprazole, lansoprazole, pantoprazole and rabeprazole are the examples, where the muscarinic antagonist examples are piperazepine and telazepine are the example, where number 3, that is ultra protective classification, in that the examples are sulfurate and bismuth compounds, and other drugs like cisapiridine and prostaglandins are the examples for the classification of anti-ulcer, where the mechanism of action and therapeutic uses of proton pump inhibitor are in that the proton pump inhibitor. So the proton pump inhibitor are the substances which are used to treat certain disorders of the stomach and the intestines, such as heartburn and ulcer, where the proton pump inhibitors mainly blocks the action of the enzyme in the stomach and reduces the amount of acid which is made in the stomach. So example, omeprazole, lansoprazole, pantoprazole and rabeprazole. So the omeprazole, it is a commonly used proton pump inhibitor as it is considered to be prototype. So the mechanism of action for omeprazole or the proton pump inhibitors are, so these partial cells of the stomach secretes the hydrogen with the help of an enzyme, that is hydrogen and potassium ATPs, so which is present in the plasma membrane. So the final step in the gastric acid secretion due to any stimuli where the proton pump inhibitors are inactive prodrugs, they accumulate in the partial cells where they quickly get activated in the acidic environment to the sulfonamide. So the active form firmly binds the SH group on the hydrogen and potassium ATPs by the covalent bond, and specifically these are irreversible inhibits hydrogen and potassium ATPs. So it thereby inhibits the gastric secretion where binding is irreversible, and a single dose can almost totally 90 to 95% gastric secretion, where the IV formulation so should be given by continuously for first 2 to 3 days as infusion as repeated injection to obtain the maximum effect. So in the simple way, the mechanism of action for omeprazole is where the omeprazole is activated to the sulfonic acid where sulfonamide is formed and the covalent bond related to the hydrogen and potassium ATPs where the gastric secretion occurs. So these are the simplest mechanism of action of omeprazole. If you doesn't want to write in the paragraph form, you have to write in the simplest form. This is the simplest form. First you have to write this in these block form, then you have to explain the what are the mechanism of action for the omeprazole or the proton pump inhibitor. So the therapeutic uses for the proton pump inhibitors are, it is used to reduce the amount of acid in your stomach, and it is used to treat the gastric or duodenal ulcer of gastroesophageal reflux disease, erosine and acidophytes, where these drugs also used to treat the stomach infection caused by the Helicobacter pylori bacteria. So coming to the next question, that is question number 2, classify antiemetics with example and explain the mechanism of action and uses of domperidone. So what are antiemetics in the sense? Antiemetics are the drugs which specifically prevent or relieve nausea and vomiting. So the antiemetics are typically used to treat the motion sickness, and the classification for antiemetics are so anticholinergic and antimuscarinic acid. So number 2, 5-HT3 antagonist in that ondansetron, gastrodon and phalansteron, like the examples where H1 antihistamine, promethazine, diphenhydramine, doxylamine and meclizine are the examples, where D2 blockers that are dopamine blockers in that chlorpromazine and trifluoropromazine are the example, and NK1 receptor antagonist, so the example for lorapitant, casopitant and fosapretant are the examples, and lastly prokinetics in that metoclopramide and domperidone and cisaperidine are the examples for the prokinetic in antiemetic drugs. So where the mechanism of action for domperidone are, this act as centrally by blocking the dopamine D receptor in the CTZ and thereby prevent vomiting which means the chemo trigger receptor, so they blocks the dopamine receptor in chemo trigger zone and thereby prevent vomiting. So the mechanism of action, they are peripherally it promotes and forward the procession of the contents of the upper GIT tract, so particularly from the stomach due to the 5-HT4 action. So the cholinomimetic effect of the metoclopramide is restricted to the proximal gut and is due to the enhancement of the action where acetylcholine at the muscarinic receptor. So the central inhibition of vomation due to the blockage of the DA receptor in the, that is dopamine receptor in the chemo trigger zone. And the uses for the therapeutic uses are: number 1, it is used to treat the nausea and vomiting associated with a condition such as the effect of chemotherapy, radiation and cancers. So it is used in the pregnancy. Second choice, to treat a hyperemesis gravidum, and it is used to treat the migraine headache combination with paracetamol, and it is also used to treat increase in the breast milk production. Where question number 3, define antiemetics with example and classify, write the mechanism of action, adverse effect and therapeutic effect for ondansetron. So for definition and classification, you have to refer question number 2 in the 10 marks. So I'll start from the mechanism of action ondansetron. So this medication is used alone with or other medication to prevent from the nausea and the vomiting which is caused by the cancer drug treatment and radiation therapy. So the anti-cancer drugs, radiation therapy and infection of the GIT mucosa induce the release of 5-HT in the gut, which initiates emetic reflex through the 5-HT3 receptor which is present in the gut, NTS and area. So prostema in the brain, and ondansetron blocks the 5-HT receptor in the GI tract where the chemo trigger zone and nucleus tractorius litigious NTA and the prevent vomiting. So it can be given orally, IV, and oral bioavailability for these drug ondansetron is 60 to 70%, and the adverse effects are confusion, dizziness, fast hemoglobin, fever, headache, weakness, etc. And the therapeutic uses or the therapeutic effect for the ondansetron is to treat the vomiting and the nausea which is caused by the cancer drug treatment, and if it is also used to prevent and to treat nausea and vomiting after the surgery or chemotherapy, etc. So coming to the next question, that is question number 4, what are prokinetic drugs? Give example, write mechanism of action, adverse effect and therapeutic uses of metoclopramide. So prokinetic drugs are the medications that helps to control an acid reflux. So the prokinetics helps the strengthen the lower the esophageal sphincter and causes the contents of the stomach to empty faster. Example, metoclopramide. So the mechanism of action for metoclopramide, it is a prokinetic agent. Its effects are based on at least 2 mechanisms. Number 1, on one hand it acts as a CNS central nervous system as an antagonist at D2 dopamine receptor, which explains its antiemetic effect in the area of the chemoreceptor trigger zone. So, and the stimulation of the prolactin releases, where on the other hand metoclopramide is also has been agonist, so effect on the cholinergic system in the stomach and the gut. So the result is normally a general improvement for the gastroduodenal coordination. So high doses also have an antagonist effect at the serotonin 5-HT3 receptor, and the adverse effects are dysthenia and Parkinson's symptoms, GI obstruction, perforation or hemorrhage, and pheochromocytoma, and increased risk in the seizures and movement disorder where extrapyramidal reaction. And the therapeutic uses are: number one, relieves nausea, induce anoxia, and it is used after the chemotherapy for the treatment of cancer, and it is also used to help or to stop you feeling or being sick or motions or from the motion sickness, that is vomiting or the nausea. Coming to the next question, that is question number 5, classify laxatives and purgatives with example, write mechanism of action and uses of irritant purgative. So the laxatives are the substance that either loosen the stool or stimulate a bowel movement. They can also increase the intestinal transit, which helps speed up the movement of the digestive tract to spur a bowel movement. And the purgatives are, so these are the drugs which promotes the defecation. These are also called as cathartics, which compared to laxatives and purgatives, they have more powerful evacuants. So classification for laxatives and purgatives are: in that, number 1, bulk laxatives, example bran, flantage, isabgula and methyl cellulose. For number 2, stool softness, example docasta sodium, liquid paraffin. And number 3, osmotic purgatives, so the example magnesium sulfate, magnesium hydroxide, sodium sulfate and sodium phosphate, where the stimulant purgatives, in that the classification and the examples are diphenyl methanes, bisacionyl, sodium picosulfate and anthraquinones, senna, cascara, sarada. And number 3, 5-HT4 agonist, example prochlorpre and pyrochloride. And number 4, PG analogs, that is lubipersistome. So the mechanism of action for irritant purgatives are: in that the example for irritant purgatives phenolphthalein, bicasodiol, castor oil and senna, etc. So the stimulant purgative or the irritant purgatives increases the intestinal motility and increases the secretion of water and electrolytes by the mucosa, where senna is a laxative. It stimulates the muscle movement in the intestine, so which is used to deal with the constipation and additionally to clear the bowel before diagnostic test including colonoscopy. And senna is a herbal remedy which is derived from the senna plant. So the senna incorporates the sennoside, which act as a stimulant laxatives. It works by irritating and stimulating intestinal cells, producing contraction in the intestine, water influx to the intestine and bowel movement is increases. So in the block type or the content type, it is senna, which contains sennoside and irritates and stimulates the intestinal cells, produce contraction in intestines where the water influx to the intestine and increases the bowel movement. So this is the simplest mechanism of action for irritant purgatives. So therapeutic uses for irritant purgatives are: it is used to treat the constipation and also to clear the bowel before diagnostic tests such as colonoscopy. And senna is also used for irritable bowel syndrome, that is IBS, and or rectal surgery, tears in lining in the anus, hemorrhoids and the weight loss. So the adverse effects for irritant purgatives are stomach cramps, joint pain and discolored urine. So coming to the next question, that is 6th, what are laxatives and purgatives? Classify them with example: and write the mechanism of action and the uses of saline cathartics. So for laxatives and purgatives definition you have to refer, even classification you have to refer question number 5. And I am going to start with mechanism of action for the saline cathartics. So osmotic saline cathartics, in that osmotic purgatives. So the example for osmotic purgatives or the saline cathartics are magnesium sulfate, magnesium hydroxide, sodium sulfate and sodium phosphate are the example. So osmotic purgatives are solutes that are not absorbed in the intestine, osmotically retain the water and increased the bulk of the intestinal content. So they increase the peristalsis to evacuate a fluid stool. Where magnesium sulfate, it is may be used orally as a laxative to alleviate the occasionally constipation and deal with low level of magnesium. Even the mechanism of action for in the intestine lowers poorly absorbable magnesium ions and other ions, which includes sulfate, exert on the osmotic impact and motive water to be retained in the intestinal lumen. Where in the simplest form the magnesium sulfate, where the magnesium ions are poorly absorbed in the lumen, exert on the osmotic effect and further causes the water to be retained in the intestinal lumen and produces the soft liquid stool. Where the therapeutic uses are magnesium sulfate is a medicinal drug which is used to deal with prevent low blood magnesium and seizures in women with epididymitis. So it is also used in the treatment of thoracic points, severe asthma example, and constipation for barium poisoning, etc. So magnesium sulfate is also used as a laxative to relieve occasional constipation, and adverse effect are heart disturbance, breathing difficulties, poor reflexes and confusion, weakness, sweating and low blood pressure. So here I have completed the 10 marks for chapter 2. So tomorrow I am going to give you the short answer, 2 marks answer, because in the first chapter I have already completed with the 5 marks question and as well as 2 marks answers. So in the chapter second the 10 marks and the 2 marks are remaining. So today I have completed the 10 marks question and answers, and tomorrow I am going to give you the 2 marks question and answers for chapter 2 unit 1. So please do like, share and subscribe to my channel.